Good day everyone, I am Kavi from InnovaWorks. So today I am here to present about remote monitoring system in Salesforce Health Cloud. Before moving to a topic, I like to give you a general description about patient 360 degree view. Patient 360, which is nothing but all the data of a patient which will be displayed in one area, and it is easily accessible to the providers. So let me give you an example. So now I open a record of a Charles screen. So this will be the personal details of him, and at start from a medication he will follow until their last diagnosis. All will be present here. So this is the screen which is visible to the providers. So with this data, the providers can easily understand about patient, and they can provide a specific care to specific patients. So now let's come into a topic, remote monitoring system. Remote monitoring system is nothing but it is a part of a patient 360 which is used to make a personal connection between a patient and a provider. It's not just keeping an eye on patient. It's about forging a strong connection between a patient and the providers, and with this system the provider can easily track patient's health in a real time, and they can set an individual goals to them and visualize the data in the form of graphical formats. So these are the uses of remote monitoring system, and this remote monitoring system is especially designed for providers. Let me give you an example. Consider the diabetes patient and the provider suggest him a care plan. So the diabetes patient enrolled in that plan, and they have a schedule like 20 minutes walk in the morning and 20 as like as in evening. So the patient complete the schedule. At the end of the day, the care team member will update the status or update the progress of a patient in a Salesforce. So in the next appointment, the provider can easily visualize the data. They can compare with the historical data. So they will take in furthermore steps. So which is a main use of remote monitoring system. Let me move into a technical part. In Salesforce Health Cloud, we have a data model called remote monitoring and the device registration data model. This will be a combined of two, remote monitoring and the device registration. In this video, we are only deep dive into a remote monitoring, and the device registration is nothing but which is used to handle the data of an healthcare devices. So for remote monitoring, these are the four main objects which will be used. First, the code set. These are like a special code doctors use to understand different parts of your health. For example, one code might be for your blood sugar level, and another code might be for your heart rate, and so on. And the next object is unit of measure. These like the special language doctors are used to measure the health. Instead of inches or the centimeters, they use things like mgdl to talk about your blood sugar level, or beats per minute to for your heart rate. Care metric targets. These are like goals set by your doctor to keep you healthy. It's like aiming and target in a game. For example, they say we need to maintain your sugar level between the 95 mg and the 100 mg. So these targets will be stored in the care metric object. And at last we have an care observation. This like keeping an health diary. The care team members will be update their progress in this object. So with this data, the provider can take further more steps. So I like to give you a live demo. First of all, I'll open an arc. Here in Charles screen, I already enter some more data. So I like to add new one. The date, name, blood sugar test 2024, and the code set values blood sugar, and need to provide a unit of measure. It will be an mg, and need to provide a numeric value. The numeric value is the value which is noted by a care team member after completion of a schedule. Here the numeric value is the blood sugar value, and need to provide a baseline unit, and the effective date and time. The effective date and time must be lesser than the current date and time, because the care team member update the status of a patient after completion of on schedule. Okay, so the effective date must be lesser than current date and time. And at last we need to check this checkbox. If you didn't check this, means this current updation will not be taken into a calculation. So that's it. You need to save it. So and need to provide an observation status will be registered. So the record will be successfully created. Once it will be created, you need to refresh it. So here you will see some more changes in the graph. So with this value, the provider can take further more steps about patient. So that's it. Thank you.